Hello and welcome back to Dentsply Sirona World News. I'm your host, Cassandra Costa, and I'm here with the illustrious Dr. Melisa Rathburn. It's a pleasure to be here with you.
Very nice to be here as well. Thank you.
Have you been enjoying Dentsply Sirona World?
It's lovely. This is the first time that I've been to this meeting, and I talked to some of my general dental colleagues in Atlanta, and they told me by far it was the best meeting, and I can see what they're talking about.
And did you go see Jim Gaffigan last night?
I did not. I had a preparation for a meeting this morning that I had to speak at, so I was actually polishing up my my talk.
Well, that's a good thing to
Yes,
do
it is.
as well.
Yes.
I hope that the meeting went well this morning.
It did. It did.
So, we're here with the Ortho Group, and
Yes.
you're an orthodontist. Tell me about the SureSmile aligners and how that has helped your practice.
Well, first of all, I've been with the SureSmile community and the SureSmile family since 2004, so we've been using this proven technology for many, many years. And the SureSmile aligner has now given us some options for other aligner therapies that is going to allow us to use the clinically powered planning system that has been proven over the many years. So it's definitely transformed our practice, given us some options other than the typical braces that we use. So we've really loved using it, and it's definitely made a difference in our practice.
And what has been the difference for you guys?
Well, the difference is really the options, and mainly clinically, it's clinically proven, but it's clinician controlled.
Mm-hmm.
So we have a lot more clinician control over our treatment plans and over the delivery.
Mm-hmm.
So we now have some options for our patients, but we can actually control them.
Mm-hmm. And so in that control, are you sending your cases out for the SureSmile company to produce, or are you doing the in-office aligner
We're actually
design?
doing both of them.
Both of them.
So for in-office aligners, we've been doing that for actually several years because we've been part of the SureSmile community, and as an orthodontist, I've been able to use the software to make my own aligners. At the same time, now with the advent of the SureSmile system, I will now be able to do the full service aligners using the SureSmile aligner, and I will be submitting cases to that as well.
And then that'll give you control over how
That's
you
right.
want to handle your patients.
Exactly.
Great. So that has a lot to do with the aligners for teeth straightening. What about brackets? How has this software work for brackets?
Well, for me, again, since 2004, we've been using this amazing software, and using the wires that are produced for SureSmile and the robotic vent wires and the design with the software has allowed us to really treatment plan and treat our patients in half the time.
Oh, great.
So we're seeing just amazing results, and it's not because you're moving teeth faster, it's because you're using the planning tools to move the teeth more efficiently.
Okay,
so
that
for
makes
us,
sense.
it's really less treatment time.
That's awesome, and I know patients love
Yes,
to get
absolutely.
treated quicker.
It has definitely set us apart, I think, from our competitors
Yeah.
to actually look at something and to be treated in a shorter period of time, but also with the quality results that we're used to seeing.
Yeah, that's a really great differentiator for your practice.
It is. It's fantastic.
Wonderful. Well, thank you so much, Dr. Rathburn.
You're very
It's
welcome.
been a pleasure.
It's been a pleasure.
We'll be back later with more Dentsply Sirona World News.